This week we have 3 chapters that we're going to go over, and then we'll be talking about the NCLEX test and completing the presentation. So I have 2 voiceovers, and then I have 1 PowerPoint that is has notes under it, so you don't have a voiceover for that one, and that will be chapter 23. So going with chapter 22, this is consumer relations. In healthcare, nurses are going to be responsible to their consumer, who is the patient. Depending on the context of where you live, they may be known as the client, the patient, or the customer. So nurses have the responsibility of setting the tone for effective staff-patient interactions. And so nurses are the healthcare providers who are going to spend most of the time with the consumer. Therefore, effective consumer relationships are a very important part of the patient satisfaction and positive outcomes for patient care. Nurses are held in high regard by these consumers because they're the ones they see. Consumers view nurses as very knowledgeable, worthy of respect, concerned for others. They're honest, they're caring, confidential, friendly, hardworking, and especially trustworthy. In 2003, they actually did a Harris poll, and they said 49% of Americans reported that they perceived their nurses to have the greatest prestige. And also that nurses are at the top of the list in the 2004 Gallup poll of the public's rating of honesty and ethical standards for various professions. And as you go through the years, you will see also where nurses have been ranked very high as one of the top professions for honesty and integrity and ethics. Nurses have been at the top of the list in all but 1 year. They were added to, since they've been added to the annual survey in 1999. The public has very positive views of nurses. About 79% of the public ratings say that nurses' ethical standards and honesty are high or very high. Nurses actually have, a favorable status with the public. They occupy positions of influence. They can even foster and promote successful consumer relationships across healthcare settings. So the public is actually becoming increasingly more knowledgeable about healthcare. And so as we see in the 2000 census, that 42% of households have access to computers. Here we're looking at consumerism and healthcare, and as you see here through the bullets, one of the things that we are seeing that there is a lot of comparison shopping for healthcare services through exchanges, and this is your ACA, and some of the latest results just hit the news, so you might want to read about that. Also, through health technology, individuals are finding information about their labs, diagnoses, their results, appointments, and any questions they have. So they go onto this website where it's linked with all their doctor's offices, and that's where they can go and get their information about their health and their health care. Under healthcare disparities, we see that people are looking for quality and cost-effective nursing care. You have good versus bad information. So whether someone, when they're looking at a site and reading about information about a medication or a treatment, or maybe some kind of, health issue, is it really an acceptable site, or are they really looking at an advertisement that's trying to get someone to buy a certain product and they don't even realize that? So they need to know what are those good, acceptable sites. Most Americans do have difficulty using and understanding health information once they get it. Those who also have issues with healthcare insurance will use the EDs if they're having difficulties because they can't afford healthcare. So they know the ED is not going to turn them away. Unfortunately, when they're discharged from this area, these areas do not help to manage their care once they're home and when they're discharged. So they don't give them the information that's going to help them to manage their care at home and whatever resources and needs that they have for continuing with their health care. When we talk about health literacy, it's a major concern in the delivery of safe health care. Half of the Americans, adult Americans, about 90 million, have difficulty actually understanding and using that health information, as I stated before. And this is actually came out from the Institute of Medicine report on health literacy. The definition of health literacy has been used by Healthy People 2010. So the key points about it include that it involves more than reading ability, it involves understanding the expectations, preferences, and skills of consumers, as well as those of the provider. So think about what you might feel like if you were diagnosed, let's say with a chronic illness, diabetes. What would you be worried about? What would you want to know? What if you work in a setting where caring for diabetes is not common and you didn't know very much about it? What would you feel like if your healthcare provider assumed that you understood how to manage this newly diagnosed illness? So people are limited, with limited health literacy, are very vulnerable. So this is something that we need to think about and strategize ways that we might facilitate to our patients understanding about certain basic healthcare information. There are three types of consumer relationships. You have the healthcare provider and consumer relationship, you have the agency and consumer relationship, and you have the nurse and consumer relationships. Recent trends in healthcare provider and consumer relationships can include a change from single private enterprises to a multi-group practice that also includes your nurse practitioners, your physician's assistants, certified midwives, and other healthcare professionals. The incorporation of group practices into HMOs and managed care organizations or physician hospital organizations is another. Patients possibly not knowing their healthcare providers as well as they might have had in the past, so not really knowing who they have or who they've been changed to, or maybe they have a hospitalist. Economic forces possibly causing a turnover of healthcare providers, particularly those in the underserved communities. Consumers are not having the option of selecting their healthcare providers right now. These changes may result in decreased opportunities for the development of trust between a healthcare provider and the consumer. And so these changes also illustrate the importance of treating consumers with respect. If they're not treated with respect, they're not going to come back. Nurses have responsibilities in consumer relationships in 4 different areas. So service, advocacy, teaching, and leadership. So we're going to go through each of these individual services and relationships. Right now what we're seeing is that there is some unrest and insecurity in healthcare. Think about examples and try to come up with an example with each one of these bullets. And so how do these forces have an impact on nurse-consumer relationships? What might nurses do to promote positive nurse-consumer relationships in difficult circumstances? Some of the things we have to think about is focus on the present, listen to your patients, develop good, effective communication skills, and de-escalate tense situations. So how can a nurse advocate for and promote positive changes in your healthcare environment? Describe the role of nurses in the development of a health policy, voting as an individual, memberships in professional associations such as the State Nurses Association, ANA, writing or talking with a legislator about a key issue, active participation in the healthcare organization, taking part in committees, and making sure that nurses are represented and have leadership roles in key communities. We do have that service orientation, so this is going to be a little demonstration here looking at these bullets. And we are consumer driven. It means we respond to the needs of our customers. Nurse managers need to monitor data from a variety of sources to meet customer needs. This is looking at demographics, clinical quality indicators such as nosocomial infections, number of falls, pressure ulcers, pain management. They're also going to be looking at those patient satisfaction surveys, technology trends, financial performances, market shares, and competitor analysis. The consumer is going to be focused on how can nurse managers ensure that their facilities are customer friendly. An example might be a transport service and patient encounters with numerous staff members. How does one assess what is important to the patient? What needs to be changed in your agency so that you're more customer friendly? Such as, I'm thinking about the little transport bus that you see riding around to help patients and families get to the facilities. As an advocate, again, we want to defend and promote the rights of our patients and everyone else. So, think about how we've defended our patients and promoting their rights as consumers. And how we can look at them and respect them and their diversities, and respect their decisions, and how we can address these things within our organizations, and how we can demonstrate ourselves as being caring individuals. Some strategies to value diversity. So avoiding stereotypes, listening to your patient's concerns. How to avoid making assumptions, validate your observations, and do a more thorough assessment. When we think about observing interactions, use opportunities provided by caring for members of minority groups to learn and understand cultural values. Adjusting our expectations. That's clarifying your misunderstandings. Validate what you have observed or heard with the patient or family member. Modifying our behaviors. Think about what you should incorporate into your practice to be more sensitive to the needs of a particular group. What resources can help you to do this? So how can we create a culture where patient education is valued as an investment? Things that we need to do is review research related to patient education and outcomes. Look at systems that make it easy for nurses to document patient education, and use easy access to resources for nurses to use in patient teaching. So how can a nurse manager promote the importance of education? Inclusion of a patient teaching and quality initiatives addressed by the organization, using journal club articles that illustrate strategies for effective teaching. How can we be assured that nurses have the required competencies for consumer education? Include them in the patient teaching. Include this information on the patient teaching on the performance evaluations. Promoting the continuing of education of nurses. Promoting the certification of nurses. Asking nursing staff members what would help them to improve their patient teaching. And role modeling teaching strategies for new nurses and student nurses. This is the dimensions of patient-centered care. So go ahead and look through these bullets. They're pretty self-explanatory, and I'll get a drink and hopefully I can speak a little better the next slides. So we're going to look at the nursing process. And so when we look at the nursing process as a model for the development of a teaching plan that we want to make consumer focused. So this model can be used when teaching is implemented on an individual level, as well as you can also use it for groups as well. So assessing, analyze the learner. What characteristics of the learner might influence the nature of that patient-nurse interaction and teaching? Look at their age, their education, their cultural group, the severity of the illness, the timing, other issues in the patient's life at that time. Then you want to assess their knowledge and skills. What are the resources for assessing knowledge and skills of your learner? Well, you want to look at the patient or family or the group. You want to have knowledge of research regarding this particular patient population. What has the patient been taught before? What does the patient know about the particular problem? What does the patient want to know? Patient record, teaching record, and past participation in teaching as well. This slide illustrates some steps for diagnosing and planning the educational content. So what do you want to think about what are the important things to consider in developing the content. You want to think, what is the most appropriate teaching method? Is it one-on-one teaching? Is it group teaching? Handouts? Maybe some audio-visual or electronic media? Or maybe some type of combination of these. So things you want to think about. What kind of time frame is appropriate to give the learner and the content? How would you assess the readiness to learn? What do you do if the patient is not ready to learn? How can you facilitate readiness to learn? And how do you decide what it is that you wish to accomplish with the patient teaching activity? What are the patient's preferences? And how do you find out about standards of care related to a particular situation? Then we look at implementing. So now we're going to look at strategies to implement our teaching plan. So we're going to use the scenario provided in the text on figure 16.1 and think about how you would address the following. When would you initiate the planning strategies for teaching? How would you determine whether the patient is ready for teaching? How would you sequence the instruction in teaching a 16-year-old how to administer an insulin injection? What are some teaching aids that could be used? What does the research say about teaching insulin injections? Is using an orange for an injection an acceptable strategy? What are your group appropriate strategies that could be used in implementing the teaching in a particular situation? And what modifications might need to be made to accommodate cultural differences? And as always, we get to evaluating. So you want to think of some questions. How will you know when learning has been successful? What examples of successful strategies for the assessment of learning? Can you describe situations where you have discovered that the patient has not learned or has misunderstood key concepts? How can nurses be sensitive to potential miscommunication and misunderstanding in the patient teaching? How do you evaluate the patient's ability to learn and continue with learning? And what are indicators that you might need to change your strategy for the consumer's learning? On the slide, this one demonstrates or illustrates a general systems theory model for patient teaching. And it pretty much makes sense when you look at the input, throughput, output, and feedback. So for your input, let's say we're looking back at the Hispanic adolescent who has diabetes. He's 16. So some of the things that you want to consider for your input, look at figure 16.2. So you want to present information about the disease, the procedures to be learned, the skills necessary for successful achievement, and the cause and effect relationships. Then you want to have the patient education materials in Spanish. Make sure it's the correct dialect. We can't always assume that everyone who speaks Spanish has the same dialect. And you want to demonstrate the drug administration technique. And there's your input. When you want to consider the throughput, this is, in context of teaching, it's the amount of teaching that can be accomplished within a given period of time. So your strategies to address the throughput is also from figure 16.2. So you want to look at the language barrier eased with the materials printed in Spanish, the fear threat to the macho image for a typical 16-year-old boy, and allow them time to practice techniques that have been demonstrated to them or for them. Now when we provide output or providing feedback. This is still using that same example. Provide praise for a successful return demonstration. And then you want to provide examples of sports heroes, maybe movie stars who also have diabetes. Maybe even research and give them the meaning of diabetes, what that means. And have them look it up on the internet and then find out who has it. Provide praise for specific goals. Maybe they had a successful insulin administration, or maybe they used the syringe correctly. Maybe they have a better understanding of issues related to insulin preparation and administration. Here's some nursing leadership strategies, and they're pretty self-explanatory, so I'm going to let you look at the next 2 slides and read the bullets. And here's the second set. So how do we foster excellence? This is allowing professionals to influence our practice. So again, participation in committees, get input for the development of key policies and procedures, make sure that the direct patient care staff members have a consistent mechanism for input into the organization's decisions that are going to be related to patient care. And there's opportunities for staff to learn new skills. Make sure there's formal continuing education, staff development programs, and the inclusion of staff in the needs assessments of such programs. Training and support for the development of new responsibilities that are going to be related to committee participation. Lastly, recognition and rewards for success. And we all love that. We love having some kind of recognition for hard work. So providing staff with information about patient satisfaction scores, including the staff in problem solving related to key issues and initiatives that are designed to improve patient satisfaction. Praise the staff members for demonstrating effective consumer relationships in handling difficult situations. Encouraging your staff members to seek national certification, including reward mechanisms in a pay scale and evaluation processes. Okay, that's all I have for this chapter.